Okay.
All right, fantastic. Okay. So, hello everyone. Welcome to the Women and Girls Foundation's new web show, In the Movement. I'm your host, Camila Rivera-Tinsley. Each month, we will be interviewing incredible people who are working towards creating a more sustainable and equitable future with conversations focused on gender, racial, and environmental justice. This month, I'm thrilled and honored to have my guest, Dr. Lichtveld, join me. We'll be discussing her work and how it impacts the health of all women here in this area, and also how it intersects with climate justice. All right, thank you so much for joining me, Dr. Lichtveld.
I'm delighted to be part of your show and delighted to have the opportunity to be directly engaged with your audience.
Awesome. So the first question that I have for you is, just tell us a little bit about your journey to the University of Pittsburgh. And I know a little bit about your backstory, your incredible work with the CDC and with the World Health Organization, but I'd love for you to share that with us in your own words.
So I have to take you back to the country I was born, and many people don't know that country. The name of the country is Suriname in South America, and back then, and my commitment to grow women leaders stems from that background, and so I think it's important to kind of put that in context. I graduated at 23 as a physician, and I knew for sure that I always wanted to serve communities. And so rather than staying in the academic setting, and now I am in an academic setting, I decided that the best way to serve is to work with descendants from slaves and indigenous populations in the Amazon rainforest to provide care there, and care that happened via dugouts or canoes, care that went overland in cars, and care that went through the air, where you could land on a small strip and be in the Amazon rainforest to provide care for children, and particularly also a large degree of pregnant women. And so I did that for several years, and then one day there was an aha moment. That aha moment came when 95% of the kids that lived there did not have, and many of them girls, were not immunized against childhood diseases, like measles and rubella. And so I thought there must be a smarter way to do that. And the smarter way was, in my younger time of career, is to work with women who were what we now call community health leaders, who were elders and tribal leaders for tribal medicine in their villages. And so those tribal leaders, including a Roman Catholic nun, were instrumental in getting us from 95% not covered to 95% covered in 3 years.
Wow.
And so how does that effort relate to medicine? And that was the public health aha moment. And so it looked at not only being instead of, or in addition to, I should say, the individual being a patient, the community became that patient, because we had a community strategy for intervention so that we could increase the immunization coverage. And so I came to specialize here in the United States and couldn't go back because of a revolution in the country I came from. And so I spent about 20 years at the Centers for Disease Control, as you mentioned, working on issues of women's health, working on issues of disasters, and particularly disaster preparedness. And it's that where I had the honor of co-leading the Minority Health Office, but particularly starting the environmental justice work back in 1994, when President Clinton issued the executive order that environmental justice should be a coordinated effort across all federal agencies. So the Agency for Toxic Substances and Disease Registry, where I worked very closely with NIH, particularly the National Institute of Environmental Health Sciences, to work on both the practice, but also the research in communities. And so I was very involved in environmental justice areas and communities all over the country, but particularly in the Gulf South, in Louisiana. And it turned out that after my 18 years with the Centers for Disease Control and Prevention, I end up in Louisiana as part of my tenure then at Tulane University School of Public Health and Tropical Medicine. It is there where during Hurricane Katrina, we worked with many women organizations to evaluate what the impact was of mold on children with asthma. And many of those were children of disadvantaged and minority, particularly African American communities. Fast forward 5 years after that, we had the oil spill. And I was able to get was funded by the National Institutes of Health to have a unique consortium about women's growth. So the GROW Consortium, the Gulf Resilience on Women's Health, focused on pregnant women and reproductive age women and the impact of exposure or the stress about the exposure of the oil spill on their pregnancy, but also on birth outcomes. And so, as you could see, this trajectory of focusing on women's health and environmental justice and now climate justice has been in my career for decades. And so I'm really pleased to share that with you and share that with the audience.
What a fascinating and engaging story. I love the holistic approach that you learned at the very beginning of your career. And that approach has seemed to serve you and the communities that you've touched very well throughout your entire career. So while you're at the Pitt School of Public Health, you've decided to change the focus to climate change. And I want to ask you, what makes the climate change crisis, a public health issue?
You know, many people, the way if you stop somebody on the street, they would say, well, what's the biggest climate change? What's the biggest public health threat that would be electric? I bet you 95% of cases, you'll get the answer of, oh, it's that pandemic. It's COVID. I could tell you that we in public health have dealt with pandemics since the earliest of times, right? Cholera and the Black Death and all of those. So we know, and in the several influenza pandemics. So we know how to deal with pandemics. Now, we didn't perform very well during this pandemic, but we're doing better collectively as the world, you know. But really, the most significant and persistent health threat that's facing us is climate change. And I say that with great confidence because I'll give you a couple of examples. Let's take heat. We know it's warmer. It's October almost, and I'm sitting in a very thin blouse talking to you. It's warmer outside, right here in Pittsburgh. So heat and health have always been connected, but not been seen as a connection to climate change. We know, for example, that particularly in nursing homes, where there aren't air conditioner systems available, elderly people with chronic health conditions are the first to suffer and unfortunately the first to be among the deaths because of the heat exposure. But often the heat is not seen as an important contributor to the ill conditions and to the unfortunate outcomes. But you'd see the diagnosis maybe being, well, hypertension or a heart attack, but physicians in general are not trained during medical school of the impact of climate on health. A second example, and very prevalent in our area, whether it's Pittsburgh or further Allegheny County or in Pennsylvania, is air pollution. There are, in addition to the chemicals that are in the air, particularly in the outer air, there are little teeny tiny particles called particulate matters that when you inhale them and you breathe them in, they actually will stick in your lung and you can't cough them out because they're so small. Those particles not only affect your lungs, and so people with asthma, people with chronic pulmonary disease, people with emphysema, so they don't only affect the lungs, but they also impact people with heart conditions. And so we have increasing evidence to show that. And so the worse the climate gets, where particulates and these teeny tiny ones, they can come all the way from the Saharan desert to Puerto Rico, for example. No, those are continents apart. Can impact kids with asthma, but also people with heart conditions. And so wherever you look, climate is very much a culprit of our health status and our diminished health status. I mean, the last example I will give you are infectious diseases. So particularly vector-borne diseases. So mosquitoes carrying disease. Dengue is one that we know particularly globally, including the country where I come from. But who would have thought that we have native dengue cases, so not from travel, in Florida, in Texas, in Louisiana, in the South. So you see that the mosquito is able to move outside of its regular habitat, in, for example, the Caribbean in this case, to our country. And so how is that possible and how does climate change work on it? So you could see that climate change is impact so many other diseases, and just like we saw with health disparities way back when and environmental justice, it's disproportionately impacting minorities and people who are disadvantaged and poor.
Yes, everything that you just said is really resonating with me. Before my position now, I used to be an environmental educator. And so that is why I see the synergy of all of these issues so clearly. And it does my heart good to hear you as an expert in your field to be able to share just why these things are inextricably linked. You've talked a little bit about how climate change impacts marginalized communities. Can you expound a little bit more on what those differences are between marginalized and non-marginalized communities?
Yeah, so there is a big area of public health that's called the social determinants of health. So those are the things that often we don't pay attention to. So two areas. So the social determinants of health, and I'll talk more about that, and community capitals or the lack thereof. So community resilience and community vulnerability. So the social determinants of health are things like poverty, education, access to care, having insurance, access to transportation, and of course the financial, but also the governance structure. So how does policy impact us having cooling centers so that when it's we could avail ourselves from cooling centers if we don't have air conditioners in our homes. And then there are issues of community capital. So those are things like, what's our governance system look like? Who decides how is our transportation system? If we have community members and patients who are obese, but yet they don't have good walkable neighborhoods because the sidewalks aren't in place, how then can we expect when we tell a patient, well, you need to lose weight? How could they do that? How could they do that if you don't have grocery stores that have healthy foods? And you tell them, well, eat a healthy diet. And so whatever we do, those social determinants of health and those community capitals directly link with how resilient not an individual is, but how resilient the community is where that individual lives, or how vulnerable that community is.
Thank you. The theme that I hear repeated throughout your personal story, throughout the applications of how you've been able to impact change, is this word community, and how important it is for us to look at multiple factors and to look at people and who they interact with and the space that they live in as a whole. So let's pivot a little bit to language and communication. So people have been starting to talk about climate boiling and not climate change now. What does that mean?
So I have dropped the word change and I talk about climate and health because we can discuss our individual political choices or how we talk about climate, but we cannot deny the importance of our health. Nobody will say, well, I choose bad health over good health, correct? And so if we all choose good health and we all choose health for all, not only our individual health, then what is it that impacts that good health? And that's what we need to address. And what is remarkable is the misunderstanding, consciously or unconsciously, about the role of climate that impacts good health.
I love hearing that, just as a person in my education background, thinking about how to communicate in the most effective way to young people, to all people. And what's been weighing heavy on my mind is how can WGF, in my role here, how can we help to continue that communication and that education of community members, and in particular of birthing bodies and femme-identifying individuals. So that's something that keeps me up at night. I'm really curious about what keeps you up at night.
Well, there are five things that keep me up at night. The first one is one that truly keeps me up, as you could see. I have gray hair, or maybe salt and pepper hair, and salt is taking over the pepper here. And so it's really important for us to grow a diverse workforce. And in my smaller space, the public health workforce, as the Dean of the School of Public Health here at the University of Pittsburgh. So we've done two things, and they're beginning to pick up. And I'd love for your organization to be part of that learning process. One is we recruit students, and particularly minority and disadvantaged students from local high schools right around us here in Pittsburgh, to spend a week with us, juniors in high school, to spend a month with us, 4 weeks with us, and learn about these very issues and climate being part and parcel of that. And then they actually have a research project that they present. I've done that successfully in the Gulf South, and this year we just finished our second cohort, and they come to us in the summer as a junior or as a senior, right when they finish the regular school year. We have trips to community organizations as we do that, and our community engagement centers that the University of Pittsburgh so prominently uses. I'd love for them to be able to hear from you when they're here. And so we'll make sure that you get that invitation. The second is that Next Level Up. We are funded by the Centers for Disease Control Prevention. We have a 5-year multi-million-dollar grant to bring in college graduates from community colleges and juniors and seniors from 4-year colleges from all over the nation here for 2 whole months to be fully embedded and learn how to do not only research, but really learn about public health. And my deliberate 3 focus areas, and I actually took a chance at that, just like I did after the oil spill, is 3 areas that very much are at the center of our conversation: maternal and child health, environmental justice, and climate and health. And so we selected the candidates, the fellows, for this program based on their area of interest in each of the 3 areas. And so both our faculty and their research projects are integrated in those 3. And so for that program, I'd love to invite you to
Oh my goodness. I
And,
would be so thrilled.
and then there are the other four areas that are all climate related. So food security and safety. And often people don't know what the difference is. Food security is what we have in our country, not having enough food, people going to bed without, kids going to bed without a proper diet, without food. Food safety is it pesticide free? Is it safe to eat? You hear very often about foodborne illnesses, so that keeps me up at night. The second is air pollution, and we talked about that.
Mhm.
The third is water and water, water safety and water security. We have both floods and we have droughts in some parts of our countries, right? And then the last one is infectious disease. And of course, we could talk about the pandemic, but particularly the infectious disease that are impacted and transmitted by factors. So those are the four things. But the thing that keeps me up most is to make sure that there are people with there are lots of emerging scholars, and particularly as a promise that I made to my now deceased mother is to grow women leaders, that are women leaders that are following me behind.
Well, I appreciate that. And I'd love to join my forces with you because WGF, we believe in investing in young self-identified women, particularly through our Girl Gov program. And I am sure that there are alumni of our Girl Gov program and active participants who would be really interested in participating in some of the programs that you described and also just learning from you.
That would be
So
lovely.
yes, I'm looking forward to making those connections in the future as well. So we've talked a lot about huge problems and the things that you talked about keeping you up at night. I can concur with those, and it's going to take a huge village and a community. The question that I have for you is, what can individuals do? We often know that people feel paralyzed. They can feel paralyzed for lots of different reasons by these large issues. But how can we have a little bit more agency over these types of issues?
And so each of us, we can't wait for Jim to do something. I'm so glad you asked me that question. Each of us can take actions. We could think about our own carbon footprint, right? Whether we fly or drive. Those are very personal decisions we make. We could think about what we do in the air in our home. In some cases, indoor air is more polluted than outdoor air. I always give the example of the very nice smelling air fresheners that we put in our home, or if we take a very relaxing bath with a candle, those are potential chemicals that we put into the air, and they're not they can harm the lungs of particularly of people with asthma. So you can take those actions, but we can also think about what is it that we put in the air, or what is it that's in our water, and we can vote with our feet, so to speak. We can make sure that where we live, where we advocate for cleaner water, better air quality. And so we exercise both or what we know and what we want to learn, and really involve kids in this learning, because the sooner we start, the better. But we can also vote with our feet, of the actions that we take. I believe that if there is enough consensus within communities and working with communities, that we can bring about the change that we need, because nobody's against good health. That's where we started our conversation. You didn't ask me about our school. We have a school that's 75 years old. You could see my button there. And we're so proud to be part of the community. We're so proud that our faculty are in the community doing research and education and service. Our Bachelor's of Science and Public Health program requires our college students to have 120 service learning hours in the community before they graduate. And in our 75th anniversary, we're celebrating that childhood disease where we talked about the vaccine in Jonas Salk, and Jonas Salk, the Salk vaccine, the polio vaccine, and we have an exhibit here, and I welcome that you come and visit our exhibit and your organization. It's an open exhibit for our community because we are part of the community. We're not some secret place.
I'd love to visit, and I'd love to coordinate some others to come and visit along with me. So thank you for that invitation. I love what you said about people making choices within their own homes, but also not waiting for people to do things for us. So that is also something that WGF has stood for the last 21 years, is making sure that people understand the civic power that they possess and the power to make change, just like you are making change and you're investing in others around you to make change. I want to take this time to put a little plug out there to make sure that young people, if you're listening, that you, as soon as you turn 18, that you make sure that you avail yourself and you get yourself registered to vote. Though now in Pennsylvania, there's some really great legislation, so we don't have to work so hard to get ourselves registered, but to make sure that we're using our voting power and that we communicate with our elected officials. So those are all the questions that I have for you. I wondered if there was anything else that you wanted to share with the audience that may be tuned in today or with me.
First, let me say thank you for your leadership. It is great to see women leaders like you in our community. Thank you for what you're doing and what your organization is doing. We can't spend enough time and enough of our efforts of growing women leaders. You will find me right there with you as we do that. And we will not make progress if we don't do it for all, if we take that individual approach rather than community approach. Our School of Public Health is exactly about that. We would really want to work with you to make sure our research, our education, our service efforts are in service to our communities. And so the doors are open, and I welcome your organization members as students, as learners, but also for us as mentors, so that we can learn from you. Our university is one through our community engagement center that's right there within the community, and growing leaders who can emulate who we are. Is something that is not only very close to my heart, but that's something that I put a lot of energy in. So I'll look forward to learning from you and your organization. Thank you so much for having me.
Thank you so much. I'm really looking forward to our continued conversation. And you truly have inspired me to keep doing this work and to keep digging into the connections between women's issues, climate justice, and environmental justice, and how we can be a part of that movement as well. And I want to end by saying it's really also wonderful to see a woman of color, to see diverse voices also taking on this charge, because I think that that's really important as well. So thank you for this time. Looking forward to staying connected. And I can't wait for everyone to learn about your good work and to come and visit.
Thank you.
So, thank you. Have a great rest of your day.
Thank you.